Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. Today, we're joined by Jared Olson, the Health Department's Senior Population Epidemiologist, here to talk about social prescribing. Jared, thank you so much for joining us.
Thank you. Thank you for having me.
So earlier this week, we hosted our annual Community Health Improvement Plan event, or CHIP. Can you explain what CHIP is and why we host an annual event?
Yeah, absolutely. So every 5 years, we consult with the community in order to assess community health and identify some key needs that we want to tackle over the next 5 years. So this current CHIP, or this current Community Health Improvement Plan, started in 2024 with two needs that were identified by the community. One, to improve access to and help create community building spaces, and then to, at the same time, also increase access to social support across the community. So that's what we were coming together this year. This is our second annual CHIP event, and we had a great time.
Awesome. How did the event go?
We had about 140 folks from across the county joining us. And we spent a lot of time talking about social prescribing. That was the theme of the event. And we had opportunities to hear from some clinicians and practitioners in the community who are already employing this in their day-to-day work. And we also had an opportunity to share a little bit within our communities, get to know each other better, and think about how we might continue to enhance social connection in Larimer County.
What is social prescribing?
So social prescribing is a practice that initially came out of the UK, and it basically means that instead of a medication that you might be prescribed by your doctor, you walk away with a prescription for something else in your life, whether that be consultation for employment or resume services, whether that be nutrition advice. It could be a prescription to go join a dance class or do something else in your community. And in the UK, they have a structure where they have clinicians that refer to other kind of social workers in the community. And those folks really address what matters to that individual, that patient, and help target the social activity that would make the most sense for them and be most meaningful to them.
You mentioned that this idea started in the UK. What's the history behind social prescribing?
So as I mentioned, it did come out initially out of the UK, and it's been used in their health system over there pretty extensively. But it's been an idea that's been adopted in other locations, including across the U.S. as well. And the idea here is we know that we can reduce costs, that we can reduce reliance on the medical system, and that we don't have to necessarily fix every challenge that an individual has with something in the doctor's office. It really increases the agency that individuals have and improves their ability to make positive changes in their own life in ways that, we can't always rely on the doctor to do everything for us.
Has there been any research done around the effectiveness of social prescribing?
Yeah, there's been some research, some case studies, some small studies about social prescribing. And typically what we've found, or what individuals have found, is that it increases agency for folks who are engaged in it. It can reduce loneliness and improve social connection. It can improve health literacy overall. So someone's ability to not just implement the changes that they want to see, the lifestyle changes they want to see in their lives, but also to understand why those are important to them. And it can reduce the burden on the overall healthcare system because we're using the doctor's office for what it's most effective with and using other resources within the community to address other needs, housing, employment, loneliness, things like that.
So you mentioned improving health agency and literacy. That's sort of being able to identify and address your health needs kind of on your own. Is that sort of the idea there?
Yeah, absolutely. So just like literacy in general, we all have to have some sort of understanding about what it means for us to be healthy, right? So taking care of those basic needs, whether that's sleep, proper nutrition, physical activity, being outside, taking care of your social and emotional needs as well. So if we can do those sorts of things more broadly within our life, and maybe sometimes we need a medical practitioner to point this out to us, that hey, some of your medical challenges might be improved by some lifestyle changes, whether that's spending more time with other individuals and reducing your loneliness, or perhaps, doing more cooking at home.
What does social prescribing look like here in Larimer County?
So as I mentioned, it's not necessarily something that's broadly accepted and broadly integrated into day-to-day practice, but we do have some agencies and organizations that are already using this orientation and framework. So for example, Sunrise Health Center, we were fortunate enough to have Dr. Mark Wallace join us at the CHIP event, and he spoke about how his organization in the doctor's office is able to use social prescribing as a framework and a template. And they're referring patients to all sorts of community organizations that might help address some of those needs at home. We also know that within the VA, this is a common practice as well. And that when we're serving our veterans, there are lots of organizations that can meet different needs, whether that be housing or need for social connection. So those are a couple of opportunities we already know are going on in our community. And what we're hoping is that social prescribing can be something that folks across lots of different organizations take on as a way of looking to address needs for their clients and patients.
You've touched on this a bit, but how does social prescribing impact or address the social determinants of health?
Yeah, so, I think we're living in a time where there's lots of distraction and lots of disconnection, right? So if you have a long commute driving to work, or perhaps you work from home, busy lives, requirements for your employment, for your kids, for your family, you may not have as much opportunity for social connection. You may face other barriers, whether those are language barriers or financial barriers or geographic and travel barriers. So there's lots of reasons why we're particularly challenged with disconnection today. Social prescribing is a way of maybe formalizing and more intentionally looking at our own lives and also the lives of those we work with and serve to say, what are those needs that we have right now that aren't being met? And what are those opportunities we have to increase our social connection, reduce our isolation and loneliness in the community?
Who can practice social prescribing?
So obviously coming out of the UK, it was initially developed within doctors' offices and within medical providers, and it still has a ton of value there. So social prescribing can be that opportunity to have a trusted resource such as a medical provider, be able to say, here's some other opportunities that you could take in order to improve your health. But at the same time, these aren't medical practices, right? So anybody could potentially be a social prescriber, right? It doesn't require any particular expertise except understanding the resources that are available in your community and being a trusted individual who could make a recommendation to someone. So we're hoping that some of our nonprofit organizations, some of our agencies within Larimer County can start to see this opportunity. And if we can provide the informational support and informational resources necessary to them, then they may be able to make recommendations to their clients to say, hey, there are all these opportunities in our community. Let's try and take advantage of them and kind of build back that connection piece by piece.
How does social prescribing fit into our two current CHIP goals that you mentioned at the beginning?
Right. So as you mentioned, with social determinants of health, you can use social prescribing to address housing needs or food needs or employment needs. But at the same time, our CHIP focus has been on social support and community building spaces specifically. So when we talk about social support, one of the opportunities there is emotional social support. So the idea that if you're having a rough day, if something's gone poorly for you, there's somebody there that you can talk to, somebody that you can share your problems with, somebody to make it feel a little better. Lots of people are blessed with that in our community, but there are unfortunately a lot of isolated and lonely individuals too, and we know this is a growing problem. So we can use social support as an opportunity to increase that network of individuals that you can rely on. And social prescribing might be one way that we can help individuals find folks in their lives to fill that role. At the same time, informational social support is another key element that we look at. And that means being able to navigate systems and find the resources that you could use. So sometimes you might not know that a particular resource exists to identify housing or to find other opportunities to connect. We have an office on aging in the county. We have senior centers within our communities. Those may not always be front of mind for folks. So that informational social support where we can help individuals navigate and find those resources can be really beneficial as well.
On a personal note, is there a way that you really love connecting with community that this kind of shows up for you in your own life?
Yeah, absolutely. So I definitely, much like many of us today, screens can be a distraction for me. I know that there's limited time just because of work and family. But at the same time, I really enjoy spending time with my kids, and I really enjoy the social life that revolves around their school, because get to spend time with parents. My children get to spend time with other children that they enjoy spending time with. I've been coaching basketball, and that's been a real pleasure to be able to coach my daughter's team. So these are some opportunities I'm trying to take advantage of that both fill my cup and also hopefully the cup of my family and my kids.
If people want to get involved with CHIP or social prescribing, where can they go to learn more?
Absolutely. So as I mentioned, this is a developing program. We're looking to spend the next year kind of co-developing this with community and seeing where it can potentially lead us and what benefits we can see. So we would love to hear ideas, to have initiatives, to potentially have partners in this across the community as well. So we would invite anybody to just go to larimer.org/chip. And on there, there's contact information. You can see what sort of projects we were implementing last year, and we would love to hear from you.
Awesome. Thanks so much, Jared.
All right, thank you.
Are you traveling this spring break? As you work through your travel to-do list, there's one thing you don't want to forget: your health. Before you brave the airport, make sure you and your family have the vaccines, medications, and information you need to stay healthy while you travel. The International Travel Clinic here at the Health Department provides health information, immunizations, and medications to prevent illness during travel. Their team helps travelers stay healthy overseas with personalized travel consultations. During your consultation, they will review immunizations that may be required or recommended for your destinations, including things like yellow fever or typhoid, as well as medications to prevent things like malaria or elevation sickness, depending on where you're going. They'll also review information about how to avoid food and waterborne illnesses while you travel. And they can provide all this guidance and answer questions specific to your travel destinations. To learn more or schedule an appointment, call 970-498-6700 or visit larimer.gov/travel clinic. We hope you all have a healthy and memorable spring break adventure. Thanks for listening, Larimer County. Until next week, stay well, stay connected, and remember, we really are healthier together.